Matt, thanks for that live report. The Biden administration announcing 400 million N95 masks will be given out to Americans for free starting next week.
It comes as the CDC has updated their guidance, encouraging people to turn towards N95s to best protect them against the Omicron variant. Western Mass News reporter Amanda Callahan getting answers on how to best wear and care for that mask.
News from the White House, 400 million N95 masks will be shipped to pharmacies and community health centers across the country starting next week. This being the largest distribution of free masks by the federal government since the pandemic began, encouraging people to wear more protective face coverings in light of the highly contagious Omicron variant.
They have different levels of filtration. The highest level of filtration is the N95, so it gives you about 90, at least 90 and above, or 99% and higher.
Infectious Prevention and Control Coordinator at Mercy Medical Center, Magdalene Iboso, tells Western Mass News, although wearing an N95 is best, it is most important you're wearing a mask that fits properly.
An N95 that's ill-fitting is useless to you. You're better off getting a surgical mask that you know will give you a nice tight seal versus trying to get an N95 that you don't know how to wear it, has big gaps on it.
Bosa says if your N95 mask does not fit properly, it's important to put a surgical mask underneath it to make sure it's airtight. You should also wear a surgical mask underneath it if you want to stretch the life of your N95 mask. And she also says it's important to wash your hands constantly throughout the day to make sure that extra germs aren't getting on your mask.
The minute it becomes moist, the minute that elastic band breaks from it, then it's no good because that seal is not necessarily going to be there. Then you're up. Your best advice is just throw it out and get another one.
And although you may be tempted to clean your N95 mask to preserve it, Iboso does not recommend.
You can't really clean it at home. They have designated laboratories in all different places across the country, and not even everyone. Like, I wouldn't necessarily say here at Mercy, we would just wake up and say, hey, let's go and clean it. Nobody at home should do it.
Amanda Callahan, Western Mass News.
We checked in with local health departments here in Western Mass that say they have no information on the mask rollout. So we also reached out to the Massachusetts Department of Public Health to see if they had any information on when the Bay State could see the N95 masks from the federal government. And we've not yet heard back.